It only takes a minute to check your patient's catheter. If your patient has a hemodialysis catheter in place, you should check it each time they come in for their dialysis treatments. We are going to provide you with a simple way to check before you connect. A hemodialysis catheter is a Y-shaped tube placed in a large vein in the neck. There are two kinds of hemodialysis catheters. Most go through a tunnel under the skin and into a large vein, but some may go right through the skin and into a large vein. The catheter tip goes through the skin in the chest near the collarbone and down into the right side of the heart. The other end comes out of an opening in the skin on the chest through the exit site. Catheters are risky because bacteria can go through the catheter and cause a bloodstream infection. In most cases, the catheter is a short-term access. This is because it is a bridge to a fistula or graft that is a safer choice. The best lifeline for a lifetime is a fistula or graft. Why are catheters used? Catheters are used when a patient first starts their hemodialysis and does not have a fistula or graft, or if the patient is waiting for a fistula or graft to be ready to use, or there's a problem with a fistula or graft that needs to be fixed. Every now and then, a patient may not be able to have a fistula or graft, and as a last resort, will have to use a catheter for their treatments. A hemodialysis catheter should be taken out when the patient's fistula or graft is working well. Remember, a catheter is only a bridge to a better access, and a fistula or graft is the best lifeline for a lifetime. When a patient has a catheter in place, it is important to check it each time they come in for dialysis. There are 3 simple steps in the 1-minute catheter check to make sure the catheter is okay and safe to use. This guide will show you what to expect when you do each step, so a catheter gets the green light and is good to go. Be sure to follow your clinic policy and procedure for any red light or stop findings. Here is a picture of what a catheter looks like when it is taken out of the package. Here is a picture to show where it goes in the body. The tip of the catheter is in the right side of the heart. It only takes a minute to check your patient's catheter. Check before you connect by doing these 3 simple steps. What does a green light or good-to-go catheter dressing look like? Carefully remove the dressing and look at the catheter. There should be no cracks in the tubing, and the caps should be on the ends of the catheter tubes. The catheter cuff should not be coming out of the skin. Now look at the exit site. There should be no redness, drainage, or bleeding. This picture shows what a healthy exit site should look like. What does a red light or stop and report catheter look like? If you see a problem with the catheter tubing, such as cracking or kinking, or the catheter hubs are exposed or dirty, if you see redness, draining or bleeding from the exit site, and or you can see the catheter cuff, or if you see redness over the catheter tunnel. If there is a stitch still in place, you will need to check to see if it should be removed. These pictures show what a problem exit site might look like. These pictures show what it might look like when the catheter cuff is visible at the exit site. Picture A shows the catheter cuff coming out of the exit site. Picture B shows the catheter seen through a skin break in the tunnel and the cuff coming out of the exit site. This picture shows what an infected catheter tunnel might look like. If you notice any of the red or stop and report signs, you should follow your clinic policy and procedure for reporting and documenting these findings. The next step is to listen to your patient and be sure to ask them questions. What is a green light or good to go? The patient thinks they may have a fever or they have noticed something different with their catheter since their last dialysis treatment. If the answers are no, it is good to go. What is a red light or stop and report? The patient reports that they have had a fever or have one when you check it. The patient tells you there is something different or reports a problem with their catheter. If you notice any of the red or stop and report signs, you should follow your clinic policy and procedure for reporting and documenting these findings. The next step is to feel over the catheter dressing. You should press lightly on the area over the tunnel, but away from the exit site. What does a green light or good to go catheter feel like? There is no pain when you press, and there is no drainage coming from the exit site. The skin over the tunnel is not warm and feels like the skin around it. What does a red light or stop and report catheter feel like? There is pain and or drainage from the exit site when you press lightly on the area over the catheter tunnel. The area over the tunnel is warmer than the skin around it. If you notice any of the red or stop and report signs, you should follow your clinic policy and procedure for reporting and documenting these findings. If you want to know more about what a catheter looks like and where it goes in the body, you can go to this link and watch a short video.